Also filing an important health alert for your family tonight. Difficulty breathing, coughing, sneezing, fever. It's the enterovirus, and it's closing in on Western New York.
Children are most at risk of catching this respiratory illness. Women and Children's Hospital told us today it's seeing a dramatic increase in the number of patients here in Buffalo with the symptoms of the enterovirus. The CDC says children in 12 states, including New York, have been infected with the virus. The confirmed New York cases are in the Syracuse and Albany and New York City areas. News 4's Ed Dranch is live at Women and Children's Hospital with the latest there. Ed?
And Jackie, the hospital is certainly a very busy place tonight. Doctors report handling twice the number of patients they normally do in the pediatric intensive care unit as more and more patients come in with the suspected signs and symptoms of the enterovirus. The State Department of Health says cases of enterovirus have been confirmed only in the capital region and central New York, but the threat is still very real for western New York.
Most of these kids are coming and presenting with the exact same symptoms that they're reporting out in the Midwest, out in Albany and Syracuse, and so it's highly likely that we are seeing enterovirus 68 here.
Dr. Steve Turkovich is the chief medical officer at Women and Children's Hospital, where doctors are working nonstop. It's all hands on deck as patients come pouring in with symptoms similar to those of the enterovirus.
The most significant thing that will get them admitted to the hospital is difficulty breathing.
Turkovich says the enterovirus affects the respiratory system, having a major impact on kids with asthma.
So you look to see how fast they're breathing, how many muscles they're using to help them breathe, how well they're moving air. In kids that can speak, you want to ask them questions and see if they can still speak in full sentences, or are they talking like this sort of thing.
The enterovirus spreads through a cough, a sneeze, or touching something with germs on it. With that in mind, doctors are urging you to cough and sneeze in your sleeve and wash your hands constantly.
So we have to wash our hands. Can everybody put their hands out? We're going to
Kim Speraza is taking extra precaution with her students at First Class Nursery School in Tonawanda, getting the children involved.
If you don't wash your hands and you have germs, what could happen? Do you remember? You can get sick, that's right.
Parents, she says, are also an important part of the process. Speraza asking they keep kids home if they're sick.
We don't know what they have at this point, and kids can get anything, so it's very important that they just keep them at home.